Yeah, so over the past handful of years, different survey data, um, different analyses looking at trends of child mental health have shown that health conditions and diagnoses have increased about 35% from 2016 to 2023. We're also seeing in 2023, using a different national data set, that children ages 12 to 17, among them with a major depressive episode, 40% did not receive treatment. Yeah, so we looked at from 2023 to 2024, we used the household pulse survey data and we looked at parent perspective, so parent report of whether a child was perceived to have a mental health treatment need, whether that child with the perceived need received treatment, and then we looked at parents that responded whether their child received treatment and it was very difficult for them to receive treatment. And then we looked at children or parents that reported no children received any treatment and that it was due to difficulty. So we used the survey weighted proportion of this data set of households that had children, and we looked at the how many of them reported a mental health need, which we found about 24.8% of households in the US reported that there was, if there were children in the household, that they had a mental health treatment need. And then about 20, about 20% reported a need. And among those, about 25% reported an unmet need. Yeah, so we looked at associations, so we can really only say, what among parents that report an unmet need or report difficulty, we can look at, what characteristics are kind of related to these outcomes. And interestingly, we looked at family structure. So we found families with more than one child have a higher unmet need for mental health treatment. And families with only one parent report that when a child does more are more likely to report that when a child does not receive care, it's due to difficulty. So we see family structure being a really important component to whether a child receives necessary mental health treatment. We also really interestingly found some differences among insurance type. So those parents with parents that had private health insurance were the least likely to report that a child had a mental health treatment need. But among parents that reported that the child did not receive care due to difficulty, those with Medicaid or those that were uninsured were kind of reported the same amount. And so it was really interesting to see that, Medicaid, while it does, provide healthcare to a lot of people in the US, it may not be sufficient in ensuring that children that need mental health care are getting the mental health care that they need. And then another notable piece of the study that we found quite interesting, as we kind of look at the more recent landscape of mental health treatment, is just the rates of unmet need among children that attend different schooling types. So we had looked at households of children that had, whether all of the children attended private school or public school or were homeschooled, and there were higher rates of unmet need among those who were who were all children attended public school and all children were homeschooled. So schooling being a large part of a child's life and a place where they can, mental health concerns and needs can be recognized. We see a higher unmet need in different schooling types, which is interesting. So, really it just helps us to provide some insight on where strategies and efforts can be kind of delegated to improve the landscape. I think, definitely just larger data sets, different types of data. these data were cross-sectional and self-report. So, there's inherent limitations with this particular data, but definitely just kind of more research on different barriers that are contributing to this gap and this large percentage of unmet need among children, and then kind of what we can do where we can focus efforts to improve that.